Fixing your low back pain is probably simpler than you think, and for many people it can be done from the comfort of your own home. Now before you get too excited, there's no magic stretch or adjustment or exercise or pill that's going to instantly make your pain disappear overnight. But for a lot of people, back pain can be improved through a smart, gradual recovery process that takes consistency, patience, and sometimes a little guidance along the way. The problem is that most people either completely stop moving or they try to jump right back into normal activity too quickly, and both of those approaches can get people stuck in a cycle where the pain just keeps coming back. So in this video, I want to walk you through a much more effective way to approach recovery using the same framework we use at Active Independent Rehab. Recover, restore, and reinforce. Most people think recovery from back pain is just about getting rid of the pain, but that's actually only part of the process. Recovery is really about gradually rebuilding tolerance, confidence, and resiliency. The first phase I want to talk about is recover. The goal here is to calm symptoms down without completely shutting your body down. A lot of people think they should stay in bed or completely avoid movement until the pain goes away. But too much rest often creates even more stiffness, more fear of movement, and more sensitivity. Instead, we want active rest. That means temporarily reducing or modifying movements that are severely aggravating your symptoms while still moving as much as you reasonably can tolerate. For a lot of people, that may include short walks, gentle mobility exercises, changing positions more often, and temporarily reducing load instead of completely stopping activity. Movement is important because the body generally responds well to gradual, tolerable activity. This phase is also where lifestyle factors become really important. Things like sleep, stress, anxiety, hydration, and nutrition all affect recovery more than people realize. Your body heals best when you create the right environment for recovery. Once your symptoms start calming down, we move into the restore phase. This is where we begin gradually rebuilding strength, coordination, movement tolerance, and confidence. And honestly, this is where a lot of people get hurt again, because most people feel better before they're actually fully recovered. People think their back feels pretty good, so they immediately go back into their heavy lifting, sports, hard workouts, or other physical labor, but the tissue and the muscles do not yet have the capacity to handle those demands again. So instead of jumping from 0 back to 100, we want progressive loading. That means gradually exposing the body to movement and resistance in a controlled way. This phase might include core strengthening, hip strengthening, movement retraining, hinging mechanics, squatting patterns, and some light resistance training. The goal is not to avoid movement, the goal is to rebuild tolerance to movement. The final phase is reinforce. This is where we stop treating the back like it's fragile. The goal now is to build long-term resiliency and durability. Your back should eventually be able to tolerate lifting, bending, rotation, exercise, sports, and daily life. And the way we build that resiliency is through progressively loading the body over time. This phase often includes heavier strengthening, more dynamic movement, rotational exercises, carries, functional lifting, and fully returning to normal activity. A lot of people are afraid that loading the back is dangerous, but when done progressively and appropriately, loading is often part of what helps people become more resilient over time. The goal isn't just getting out of your pain. The goal is durability and confidence. If you take one thing away from this video, let it be this. Recovery from low back pain is usually a process. You calm things down, you gradually rebuild movement and strength, and then you reinforce the body so you can fully return to life and activity with confidence. That's exactly why we created Active Independent Rehab. AIR provides step-by-step rehab plans designed around the exact recover, restore, reinforce framework, including exercise progressions, education, guidance, and structured rehab plans to help people not just feel better temporarily, but build long-term resiliency and confidence. If you want to learn more, I'll put the link in the description below. Let's get moving.